So how do you diagnose ARPKD? So it's often prenatal. It's often first suspected when the mom comes in for a routine prenatal ultrasound and you see this large echogenic kidneys along with liver scarring. That's important because that separates it from some of the other diseases that can have cysts. So another important thing is even if you have a normal sonographic findings, it doesn't exclude a diagnosis of ARPKD because it might not present until the second trimester or even beyond, especially if it's a missense mutation. So prenatal diagnosis is only offered to families with a known risk of ARPKD because if you want to try and do either chorionic villus sampling or amniocentesis, these are invasive and there's some risk to the fetus. Another interesting option for families that either have both parents known to be carriers or they've already had a child with ARPKD is you can do pre-implantation genetic diagnosis. And what that involves is in vitro fertilization. You grow the embryo to the 8-cell stage. You then take one of the cells and you do genetic analysis on it. And if it's either unaffected or I suppose a carrier state, then you can just implant it, that embryo, back to develop, and taking one of the cells at the 8-cell state doesn't cause any damage. So again, later presenting cases typically have less severe kidney disease, but complications of the liver disease are more common.